Do you ever have people that you're working with say, oh no, we should have chosen a different antibiotic, or complain, like a lot of the things that we see in the day-to-day practice of like, oh no, I need to do the ear swab to treat that exactly the perfect way. What goes through your head these days when you see an ear infection? Because it's probably very different than what most of us veterinarians that are in clinics are seeing. I'm curious about that.
I had a new grad. She was probably out 2 years. She was from Northern California, and she wanted to start doing her own sort of street vet chapter or team up where she lives, which I love.
Yeah.
And that's what I love most about what's happening is through this funny thing called Instagram. So my brother came along. Nobody knew what I was doing for 6 years because I didn't talk about it.
Oh, wow.
For 6 years. I started doing it in 2012 until about 2018. I didn't tell a soul.
Why do you think you didn't tell anybody? It's amazing what you're doing.
I know. And, in the beginning, I didn't want to be judged myself.
Yeah.
And I didn't want any negativity or discouragement. I didn't want someone, for example, I didn't want to be at a dinner party and someone say, what do you do in your free time? And I would go around and walk the streets and I find people.
This conversation around shame is just like, it's the worried about, people judging or feeling shameful about what you're doing. You are doing, and you are doing a beautiful, incredible thing. I'm like, that's why K-pop Demon Hunters is is all the rage right now.
K-pop Demon Hunter reference.
I did it. It's our podcast. We can talk about whatever we want. But that's part of it. Is this like, and I want to spotlight it. Is this idea of shame? Like your heart is in the right place, and animals have no shame. It's one of the things we love the most about them, right? Like I love the one-eyed, three-legged dogs, and your heart's in the right place. It's crazy to me that, oh man, to think that somebody would judge negatively for going out and helping people.
There's, as we kids like to say, there's haters, and it doesn't matter what you're doing. Someone can always perceive it as something that doesn't fall in line with their values or doesn't make sense. But yeah, I didn't want someone to say to me, why would you enable those people? They can barely take care of themselves. Why would you empower them to help their pet?
I know what you mean. Yeah.
So I just, to avoid that, to avoid hearing that, I just didn't talk about it. And I would go out quietly, and I did this for 6 years until I finally shared it with my brother. I have one younger sibling who actually helps run the charity. And he does all my social media. And he came to me and said, you got to share these stories. Like, why would you tell anybody? And so he started coming on the streets and filming some stuff. And then at the time he said, I'm going to start posting this content. I'm going to create an Instagram page for you. And I said, what's Instagram?
Yeah.
What's an Instagram? And that's really when things took off. That was around 2018, 17. And then once word got out, getting back to what I was talking about, vets start reaching out to me across the country saying, this is cool. Can I do it where I live? And so I've been mentoring some. In fact, I had a veterinary student with me yesterday from UGA, from University of Georgia. She's a senior, and she wants to start doing it either in that area, wherever she lands when she starts working. So she was out for the day, which is great. So I have these vets. So I have this vet with me. Getting back to this example,
I distracted you with K-pop Demon
Hunters. I know.
Hunters, right?
Now that's all I want to talk about since I've seen it 8 times. I have a 10-year-old daughter. So, but no, she was out in the streets with me, and this dog had an ear infection. Talking about, getting back to your question about like what is gold standard medicine in a clinic versus what I'm doing. Is sort of, I call it essential medicine. And I lifted the ear. I'm not doing ear swabs. Sometimes I can't even examine the ear because the dog wouldn't allow it. I said to the pet parent, I'm just going to put some medicine in the ear. And I went back to my bag and I was sort of explaining to this recent grad what I'm doing. Yeah. And she said, "Oh no, I don't think we can treat the ear. Like we can't even examine the ear. What if the eardrum's intact, or what if there's a foxtail down there?" And legitimate things, by the way. Yes, it's one of the reasons we look in the ear. I want to see what's going on. I want to see the nature of the infection. I want to see if there's a foreign body like a foxtail. And yes, I want to be able to see if the eardrum is intact, right? That's why we do what we do. However, if I don't suspect foxtails, right? There's no foxtails on the dog's body. I'm going to set that aside, right? The chances of the eardrum being ruptured are also slim to none. But if I walk away and do nothing for that dog, one thing is guaranteed. It's going to continue to suffer. So do I take that 2% risk of the eardrum, the foreign body, and not treat the dog and walk away, or do I treat the dog? And to her, she felt it wasn't acceptable to put the medicine in the ear.
Wow. Yeah.
And I said, you'd rather, so we had a debate, a healthy debate. I said, you'd rather just walk away and not treat the dog. And she said, well, I just don't feel comfortable not knowing, I'd want to take it in. I want to sedate it. I want to look, really get a good look in the ear. And I said, no, we're not walking away without doing something for this dog. Now, for some reason it does not get better, we'll get it to a clinic and treat it. But I can tell you, in my nearly 2,000 cases I have personally seen in my 15 years, this is me walking the streets one-on-one under a traffic lamp, which becomes my office, 2,000 encounters and probably hundreds of ear infections, I have never had one go sideways. So given my history and my experience, explaining this to her, would I walk away? No. And in fact, I went as far as to tell her, I think it is negligence. I think you are dishonoring your veterinary oath if you're going to just I can't do anything, I'm sorry, maybe I'll see you in a week. If you walk away from this dog, seeing this dog suffer with this raging, blazing red ear infection. And after we talked it through and went to lunch, she got it. And that was the whole point of her coming with me, is you said it right. You get in this glass castle and you have all these toys around you. I can do x-rays and blood work and sedate and surgery and so forth. I can't do that in the streets. I am there to provide very basic care, but in some cases, like that $3 for the flea treatment, that $3 changed that dog's life.
Yeah.
And that's what we have to keep in mind. Even when we're dealing with people, and don't get me on the whole access to care thing, but I won't be able to help it. People come in, they have no money. I mean, these people are struggling today. They come in and I present this $800 estimate for all these things I want to do. And they're like, I can do maybe $100, $150. Well, then I'm going to do what I can for $150. I'm not going to let you walk out. But you know what? A recent Gallup poll said that 52% of pet parents are declining all services and walking out the door if they can't afford it. They're doing nothing.
Yeah, and I say this, I really believe this. Sometimes people are letting perfect get in the way of progress. As we are taught perfect, and we know that, we know that you should get your otoscope and look inside the ear every time, but you can't always do that, and some help is better than no help.